Until recently, there have been few options for people with kidney failure, dialysis, or kidney transplant. Now, new research is giving patients hope for more freedom and better quality of life. At Desert Regional Medical Center, we spoke to nephrologist Dr. Bryan Stone, who reveals some of the new technologies and research being done for kidney disease.
We have new technology where we can do more with kidney replacement. So if we reach the point where the kidneys have a disease and they progress to the point where they're not working well enough to maintain life, we have some new options there. And in the process of getting there, our job is to protect the kidneys and get rid of as many diseases as we can to prevent the kidney failure. Dealing with the kidney failure itself, what's right on the horizon, really in final trials now, is what's called the wearable artificial kidney. You have a vest that has the whole dialysis equipment in it. That means basically the kidney is inside a piece of clothing and you can wear it and people don't even know. Right now, for them to deal with kidney failure, they have to go to dialysis 3 times a week. That means they're locked into their local community. They have to make that appointment and they have a 4 to 5 hour block of time that is completely isolated for that therapy. This wearable artificial kidney in a vest gives you incredible flexibility. The quality of life goes way up, the depression comes down, the hopefulness for the future is tremendous. So that's one thing we're doing. The other question we get is, has to do with the stem cell research. They're taking old kidneys and washing out a lot of the cells and replacing those with stem cells. So the stem cell now is coming in, forming the right cell in the proper direction, and we're getting more and more function out of those. I think that's where the future is going to be. We have another one I'm watching now that they've been doing research for about 15 years, 20 years, and that is pig kidneys. It turns out pig kidneys are very similar to human being kidneys. They're very close in structure, in size. We can fit them in. They have the right structure. We can hook them up. And genetically, there are enough similarities that we can use those. Now, this is not being done yet widespread in human beings, but the research is coming along very quickly, mostly out of South America.
Dr. Stone discusses the intrinsic link between heart disease and kidney disease.
We notice in our patient population who developed kidney disease, we always had a lot of heart problems, whether it's high blood pressure type damage, what we call congestive heart failure, or even a different kind, which is called diastolic heart failure. We're now recognizing that these two run completely parallel. So if you have one, you probably have the other. So now as nephrologists, we're becoming more cardiologists as well. We now have to tailor our drugs, our choice for both. And the reason this is important is because there's, number one, no reason to save the kidneys if the person's going to die of a heart attack. And number two, if the heart's not working well, the kidneys aren't going to work well because they need proper blood flow. So these two organs have just enmeshed, really enmeshed. And we've become much more adept at treating the heart problems right up front and even aggressively going after the evaluation of the heart, getting echocardiograms, getting stress tests, pushing the cardiologists to do angiograms and things in a much more aggressive fashion than they've ever been used to doing before.